Hi, everyone. In this video, I have a colleague of mine, Lauren Fuscaldo, who is a mental health therapist in New York City. And today she's going to talk to us about anxiety and when to know it's time for you to get help. She's going to give us some solutions and some things to try if you're dealing with anxiety. I certainly know that this pandemic and being isolated has caused me to have elevated anxiety levels. And I know I talked about it in my last video, looking at all of the social media posts that are going on and watching the news and stuff like that. It can cause us to become more anxious. And so I thought it would be good to make a video and bring on a professional who treats anxiety every day. And so I want to introduce Lauren, and Lauren is in New York City, and she works with young people. She works with teenagers. She works with young adults that are dealing with anxiety and depression. And she's like one of the best therapists that I know. So I wanted to introduce her to you and see how she can offer us some help. So hi, Lauren.
Hi, Antonio. Thank you so much for having me.
So Lauren, I know that you have a private practice in New York City, and at least in the United States, New York City has been known as the epicenter. Like, there's so many cases of coronavirus. Do you know people who have personally are dealing with that at this time, or that are suffering through it or working through it?
Luckily, nobody in my immediate family, few clients that I work with, friends, family, people close to them, but nobody directly related to me. So that's good. That's a good thing so far.
So I know that you work with people in general. You work with people on issues of anxiety, generalized anxiety disorder, and depression and other things. So have the people that you've been working with, what has happened to them since this corona situation this pandemic has kind of taken over our lives?
It's definitely been a challenge, I think, just with telehealth. I think working on video chats and doing video and phone sessions with people has been a challenge. But the anxiety level, I think, that people are experiencing with what's going on is it's very unknown. I speak to some people certain days that are experiencing extreme levels of anxiety, and then the next week everything is fine. So it's kind of this jump from one feeling to the next. Nobody knows exactly what they're feeling. They're afraid, definitely. And it's because New York, I think, has been so affected by it. It's been more of a concern, I think, for my anxious clients to really want to leave the house. That fear of getting groceries becomes this big chore, and it's kind of finding ways to work around that and push them as much as they can without actually harming them, because the virus is real, and you don't want to tell somebody, well, go outside and be socially exposed to this. You have to kind of say, all right, just get what you need and we'll worry about everything else later.
I know you have a practice. Are you still seeing people in person, or like how are you managing that?
No. So I think mostly everyone that I know in private practice or even in clinics here they've switched to what's called telehealth. So they're either doing video sessions or they're doing phone sessions. Certain platforms allow for even chat sessions, chat room, but I'm primarily doing video sessions with all of my clients who I used to work with face to face just a few weeks ago.
Instead of them coming to your office, you just do like a Zoom call or a FaceTime. That's how you have been working.
I use a program so that it's HIPAA compliant. So it's a program that it's called Simple Practice. So I use their chat room, and it brings you into a virtual chat, and then they get a link, and it's pretty much like Zoom, but it's just more safe in the sense of privacy.
I think I told you this, but a few weeks ago my channel was hacked, and I know that it happened primarily because I was getting a lot more anxious than normal. And one of the reasons was because I had a family member and my sister actually was in the hospital, and I was really anxious and worried about her, and felt like there was nothing, I couldn't go visit her. There was nothing that I could do to help her. And so that really made me anxious. And so every day I remember waking up, the first thought I would have is just like, I could feel this tightness in my chest and feel anxious. I just felt anxious. And so I was thinking about, maybe I need to do something about this. Maybe I need to call someone. Maybe I need to get like help with this, because there was nothing that I could do, to help her. at that time. And then there was nothing I could do to control this crazy pandemic that we were dealing with. And so I felt like super anxious. Then I lost my channel and I was losing my mind. And so I really was thinking about talking to someone. What are some of the signs that people would be feeling or experiencing that should be looking out for that would tell them, hey, I should probably talk to a professional about this or seek help? Because certainly know it can be helpful. I just think that sometimes people don't know how much they're suffering maybe, or that they could feel some relief if they had some tools under their belt to use.
I think that's a good question. Like everyone, I guess, is experiencing this situation differently. So the most important thing, I think, it's called social distancing, but what it really needs to be known as is just physical distancing. So people still need to be in touch with family and friends on a daily basis, just for their own mental health sake. I think that just as human beings, we're social creatures, and the idea of not being able to see people physically is really disheartening to a lot of people out there, especially people who have anxiety. And that's one of the challenges, I think, that working with people with social anxiety is, how do you balance being social without being physically social with people? So it's really using the platform of technology. And I think right now, knowing that you need to get some sort of help, or you're feeling like you need to talk to somebody, the first line of defense would be call your friends, call your family, talk to them about what you're experiencing, because you're not alone with this feeling of unknown or this inability to control your anxiety or control the situation. I think that brings a lot of anxiety for many people. This feeling of unknown that most people who suffer from anxiety experience is really true right now, where we could say, well, what if this, what if that? It's a big comment for people with anxiety is, well, what if this horrible thing happens? This horrible thing is happening. And I think people are having a really hard time balancing what is real and what is fake, and just kind of sifting through news articles. I found a lot of people who were suffering the most on good, bad weeks were really listening or reading news articles very, very frequently. And that was one thing that we worked on, was kind of pulling back a little bit. It's good to be informed, and you want to be critical, and you want to read more about whatever you're trying to learn. But also, if it's causing a lot of anxiety, to kind of put it down and do something that is going to be able to take your mind off of it, because it's hard. I think that's, all we're bombarded with is news and information, and that's a great thing, but it's also, it could hurt a lot of people who don't have those sources or that support to really talk to somebody professional, or even friends or family. I think that people need to kind of keep in touch as much as possible, checking on others, make sure that everyone else around them is okay, but first and foremost, checking in with yourself every day and saying, am I getting my basic needs met? And I think a lot of what my work has been with people is making sure that they're eating, they're drinking enough water, they're sleeping. Simple things that people don't even think twice about in a normal everyday experience, they're forgetting to do, or they're so, focused or hyper focused on other things that are out of their control. So it's kind of, what can we do to bring yourself back to control? But to answer your question about how do I know if I need to talk to somebody, if you're feeling very hopeless, again, reach out to your social supports. And if you still feel like that's not enough, or you need more support, then reach out to a therapist or somebody that's going to be able to really give you undivided attention and focus on specific concerns that you have, and definitely coping skills that you could use when you're feeling like you're losing control, or when you're feeling hopeless or unmotivated. Certain techniques that you could do in that moment that you might not have thought about if you hadn't spoken to somebody about these issues, or you felt uncomfortable talking to friends about it.
If someone doesn't know anyone to ask, or isn't familiar with a therapist, what are some things that they can do to find or to locate someone that would be helpful to them? Like if they're in New York, or if they're in Arizona or California or in England, where do they start?
That's a great question. I think that, people get very lost when they're doing those searches online, or they're looking at Psychology Today. And I think that if you're fortunate enough to have health insurance at this moment, that is your first spot to look. That's the place that you want to call, whether you call the back of the card and you ask for behavioral health, or you go online and you type in providers that participate with your insurance panel. And that will give you a list of people within however mile radius that you're willing to travel. And right now you're not going to be traveling. So it's going to be people who are taking new patients and doing telehealth service, and reaching out to them and just seeing if there's spots available, if you guys connect, if there's a therapeutic alliance that can be built, or there's some sort of rapport. So really, I think doing your homework about researching specific therapists who have maybe specialties in an area that you're suffering. So, right now with my social anxiety is a big specialty that I am focusing a lot of my practice on. And it's an interesting specialty in this situation, especially with social distancing, but kind of navigating how to handle a pandemic with social anxiety. And it's something uncharted and something we've never done before. But I think a lot of, people are finding success in really just virtually socializing. And, never would I have recommended that previously in person, but I think the times call for continuing to keep in touch and be social with people despite what your anxieties might be. So reaching out to your insurance, if you unfortunately don't have insurance, which I know many Americans unfortunately don't, the best thing to do is to look, and it depends on where you are geographically. If you're in a very populated city, you're going to be able to find free clinics or even just private practices that will work on a sliding scale fee. And of course, those fees will vary depending from state to state. It really just depends on you doing your research, mentioning that to the therapist, asking if they work on a sliding scale, because many of them will, give you a discount or, a discounted rate, and advocating for yourself, explaining your situation, because I think, it is a business, but people do care, and they will try to work with you, especially if they feel like that you are going to be someone they could help. So absolutely, I think reaching out to people once you get the list, if you can get a list from your insurance, great. If you have to go online, go on Psychology Today, look at practitioners in your area. And then, also word of mouth. I think if people have a therapist that they really like, or their parents saw, or, their parents recommended for their kids, however, you get that referral, I think, give that person a call and see if it's a good fit.
Okay. This is Coco, by the way.
Hi,
Coco.
I'll show you CJ if he comes over here.
Let's see CJ. Hi, Coco. Look at the camera. Come on, bro.
Coco.
Hey, Coco.
Come on, Mama. Don't be bratty to the mommies today. I know. CJ's not feeling too well today, but he'll say hi. There he is.
He's beautiful. That's a Chihuahua too, isn't it?
Yeah, it's a long-haired.
I know that one thing that helped me, like I said a couple of weeks ago, I was like so anxious in dealing with this stuff. And so I stole my kid's dog and made him live with me. He has been a great source of comfort for me. He's a little crazy, but he's definitely someone that has been helpful. But so if someone is not sure they're ready to seek professional help or look for help elsewhere, do you have some suggestions on things that they could do to help kind of calm their anxiety in these times? I mean, maybe they're just a little bit extra anxious and want to do a few things that could help them feel less anxious. Do you have some suggestions?
Absolutely. I mean, there was grounding techniques that I wanted to speak to you about that I know you're familiar with, but I think, the viewers would be interested in knowing. But as far as, in that moment, kind of, what can I control anxieties, certain grounding techniques where you could
What does grounding mean?
So grounding is the idea of kind of stopping everything you're doing and literally putting your feet on the ground, like saying, okay, I understand what's going on. It's very common when people are experiencing like a panic attack, they'll do some grounding. And sometimes it's hard for people who are experiencing a panic attack to be able to do grounding. So it's easier sometimes for people with anxiety to do it. And it's basically putting your feet on the ground, and certain techniques could be, the five senses. It could be, what do you smell right now? What do you see right now? What do you hear? Can you taste something? Can you, put a mint in your mouth or something? And, what and what do you feel? Can you touch something, tactile, and just kind of focus in on those specific senses.
Okay, so grounding is a very well known technique, and I know that even in addition to the things that you talked about, when people are able to even put their feet in the earth, go outside and like in gardening, like that's why gardening is such an effective therapeutic type of thing to do, is because you're connecting. Some people say like you're connecting with the earth. You have your bare feet in the ground, and there's something amazing about that. So grounding always reminded me of like mindfulness and just kind of stopping and just being present of what you're feeling, and what your body is doing, and of your five senses and that stuff. And I know that I've always been someone who talks about doing meditation and mindfulness meditation, and like I even have this Muse. This is a device that I use to help me meditate. And when I was dealing with anxiety a few weeks ago, I found a lot of comfort in meditating. But as soon as I finished meditating, then I'd feel the anxiety again. And so I was like, what, it's kind of difficult. That's when I started thinking like, maybe I need to figure out some help. So besides grounding, what are some other things that people can do that can be helpful?
I think that a big, in grounding is a type of mindfulness. It's being in the present moment, where mindfulness is allowing yourself to, just be in that moment, while calmly acknowledging your feelings and your thoughts and everything that's going on around you. I think what's become really popular, and it's empirically proven, is the idea of guided meditation. And there's a lot of different apps and even YouTube channels that have 10-minute wake up morning meditation, and that people do. And one that's really common, and I think in both New York State and Michigan, is Headspace. And I've always recommended Headspace to my clients because it's a paid service, but you could there's like a few free guided meditations that you could reuse. So what they did in both those states, or the governors kind of teamed up and did with Headspace, was create a free platform for people in New York and Michigan, and I'm sure in other states that I'm not aware of right now, but they are, allowing people to use that app free of service. So I think that's a really helpful tool. I think that mindfulness it's a practice. It's hard. It takes a lot of time. It takes a lot of energy. It takes, I think people think, oh, I can't do it, or I can't meditate, and they give up really quickly. So it's something that you have to just allow a few minutes a day to really try to meditate, or practice mindfulness going on a walk. You could practice mindful eating. And I think all of, this time is a really good time to kind of hone in on those techniques, because you have that time to say, all right, I'm going to cook this meal, and then I'm going to slowly eat it. And I'm going to pay attention to what it smells like, how it tastes, what the different textures are, and just really focus. And I think when people do that, they're able to kind of forget about what they can't control or what's going on. It's nice sometimes to just get out of your head space. And I like, that's why the app is called Headspace, but just kind of get out of there and explore something new. And I think it's just good for people to be able to kind of leave for a little while. Mindfulness is kind of like clouds. I describe it as, clouds passing by, and thoughts are there, and that they're just clouds passing by, and you're just acknowledging it, and you're not judging it, and you're not getting frustrated at that thought. You're just letting it pass through and just accepting what you're feeling. So I think it's a hard practice. So I don't want to discourage people and who listen to this video or who watch this video and say, oh, it's too difficult, I can't be mindful, because it's not something that you're going to be able to pick up in a few days. It does take practice.
So I did hear, I was watching our governor in Michigan. She did this press conference, and she talked about the fact that people are struggling being stuck at home, and especially when you're isolated, when you live alone and you have to stay alone and you can't be with your family and friends, it becomes difficult. And that was an app, and this is like obviously not a sponsored video, but I'm not familiar with Headspace, but when she talked about it, and I know that New York is also doing the same thing, is offering that app or the service that's associated with it as a free thing for people who because of the pandemic. But I was really surprised when she said that it's like empirically validated, like it's evidence based, like it really does work. It's not just some app that's like, listen to these sounds and you'll feel better. There have been studies that have been done. Obviously, when they say that, there's been studies that have been done that have demonstrated that this really helps with anxiety and depression. And I mean, I think meditation is an amazing tool, and I agree with you what you're saying. It's like oftentimes it's difficult for people to get out of their own train of thought. And so when you have a guided meditation, it can be really helpful. So yeah, that's something I totally agree with you. I think that's a great idea. And in fact, I'm going to download that app myself and check it out. And then I'll have a better idea of what it is, but I think it's a great idea. So,
But it's not for everyone. I think that, some people, it might not work for them. They might have really tried, and it's not for everybody. So it's kind of finding what works for you and finding ways that you could, coping skills that you maybe could use during these times. And that's where I think, getting help from a professional is really helpful if you can do that, because they'll, be able to kind of tailor your treatment specifically for you. And if something doesn't work, they kind of scratch it out and say, all right, let's, dig deeper. Let's try something else.
the last thing I want to ask you is about relationships, because I know that there are two cases. There are people that either are not in a relationship yet, and so their dating life is kind of put on hold, because how can you date now? I mean, you can start meeting people, but that's kind of weird a little bit, or awkward, or not easy. There are people that are in relationships and are separated, and then there are people that are in relationships and they're kind of quarantined together, and that can be a problem too. Like, are any of the people that you're working with, or have you worked with anybody that are dealing with either one of those two things, or all three of them?
I think all three types, what you're talking about. Single people who feel really stuck and alone because they can't date during this pandemic. And, I've heard from different people, single people who were using this time on dating apps to get to know somebody, saying, well, we can't meet. But, you have to really err on the side of caution, because there are people who will lie and say they've been tested for COVID, let's hang out, or, asking to meet up, and, and you have to be cautious, I think, about who you're meeting and what their intentions are. But it can be, if you do decide to download a dating app during this time, keep that in mind, and use it for maybe a time to just get to know somebody and really talk to somebody new that maybe eventually, when we get out of this, you'll be able to meet.
Yeah.
As far as people in relationships who are socially distancing, it's extremely difficult. I think that the love languages speak for itself with, when there's a couple who needs that physical touch and they're unable to get that physical touch right now, it becomes a big problem. And I think that it causes a lot of frustration. And logically they understand, it's not safe for us to meet, whether or not they're living at home with someone who's at risk, that they don't want to bring, their significant other over, or they live far away, whatever the case may be. I think it's very difficult for them. But using, those apps, again, virtually connecting, using the Netflix app that I think, we spoke about before, where you could watch the movie with your significant other in sync, at the same time, and, reaching out, playing games, keeping in touch as much as possible, and then asking for what you need and getting those needs met. So yes, they might not be able to give you the physical touch, but can they say words of affirmation? Can they say something that, is going to make you feel good? Let them know. I think a lot of times couples that I work with, they're unable to kind of express those needs. I need my boyfriend to, tell me more how much he misses me, or, not play his video games and talk to me on FaceTime, simultaneously. Asking those things, saying, hey, I understand you're busy right now. And that's practicing assertiveness for these couples, is saying, I understand you're busy right now with your friends, but you know what? Give me a call when you're free. So this way, my attention, you give me undivided attention. So just, asserting yourself, like, you're busy. I understand that. Not a problem. Give me a call when you can.
Yeah, I think that people struggle with worrying that time apart is going to make the other person, kind of out of sight, out of mind, and make them they get fearful that the other person is going to somehow fall out of love with them because they're not physically present. And I think that's a big fear that some people have. But I totally agree with you about figuring out ways to still have relationship time. Like if you are used to hanging out 3 or 4 times a week, and sometimes one of you is like, playing a video game online, or like those kind of things need to be, kind of altered a little bit and changed so that you do have time to connect. Because if you're connected, I don't think it matters how far apart you are. When you're connected, you're connected, and so those insecurities are kind of squashed. What about people who are like, what about people that like, I read about something that after the quarantine in Wuhan, China ended, like 81 couples like filed for divorce on the first day that the quarantine ended because they were like stuck together for so long. Do you have any advice for people who might be, kind of stuck together and in each other's face and really can't get away from each other for a while and it's causing problems?
Absolutely. I think, I've spoken to a lot of couples who express, this cabin fever and these, you know, and what we're experiencing now, everything is heightened. So I think, things get taken out of context, things are communicated, improperly, and people get in fights. I think even family members, say one thing and it gets blown out of proportion. And I think right now, because everyone is just very anxious and just, they don't, it's a very heightened time, that communication, I think, is key no matter what. If you're in a tight space with somebody and you need a little breathing room, ask for that. But I think, in any event, the biggest thing in all relationships, even during a pandemic, is communication. It's, letting your needs be known and discussing, what's important and how, to better the situation in that given moment. They might not be able to leave, but they may be able to go take a walk and give you, a half an hour to decompress or do, something, just get some space. Maybe they'll be able to take a car ride by themselves, or, depending on the situation, maybe you'll need more or less time together. But I think communicating those needs and not letting it build up, I think that's what happens maybe more for men than women. I think, both bottle things up, but I think men tend to bottle their emotions up a lot more, and then they explode over, one seemingly small
Yeah.
incident. So I think, for guys to really, communicate, and that's tough because I think women are like, what are you feeling? What's the matter? What's wrong? And guys don't want to talk about their feelings. So, it's tough, but I think for women who watch your channel could, take that and understand, okay, my guy is not talking to me, or he's saying nothing's wrong, but I know something's wrong. So I'm gonna give him some space and let him come to me. And I'm gonna, go take a walk because I'm feeling like, there's some tension that's unspoken, and, just doing things that you can do for yourself. I mean, you're in the relationship, you're in a situation right now with a pandemic that you're home with somebody, but you're still you, and you still have to take care of you. You still have to worry about, am I eating? Am I drinking? Am I sleeping enough? My partner, yes, I'm going to worry about them, but me, I need to come first in that situation. So always checking in with yourself and making sure that you're getting your basic needs met at this time, because it's crucial.
Well, I think that you have been like super helpful, and there are like a lot of great, information, and so thank you for doing that. I hope that this is like a video that helps people. I know that it's something that would have helped me a couple of weeks ago, so that's why I wanted to do it. So thank you for agreeing to do it with me. I appreciate it so much.
Having me. I appreciate it too. I hope that was helpful.
Thank you so much.